Question number 4. A 30-year-old man presents to the emergency department with complaints of fever, 202.2 degree F, and diarrhea for the past 12 hours. There is no history of headaches, vomiting, or loss of consciousness. The past medical history is unobtainable because the patient recently migrated from abroad and has a language barrier, but his wife says that her husband had a motor vehicle accident when he collapsed when he was a teenager that required emergent surgery. He is transferred to the ICU after a few hours in the emergency department due to dyspnea, cyanosis, and hemodynamic collapse. There is no sign of meningeal infection. The blood pressure is 70/30 at the time of transfer. Chest X-ray shows interstitial infiltrates without homogeneous opacities. The initial laboratory results reveal metabolic acidosis, leukopenia with a WBC count of 2000, thrombocytopenia, and a coagulation profile suggesting DIC. A peripheral smear is performed and shown over here. Despite ventilatory support, administration of IV fluids, antibiotics, and vasopressor agents, the patient dies the next day. And the gram stain from the autopsy specimen of the lungs reveals gram-positive, lancet-shaped diplococci occurring singly and in chains. Which of the following organisms is most likely cause of this patient's condition? So we have options as A, Staph aureus, option B is Streptococcus pyogenes, C is Streptococcus pneumonia, D is Neisseria meningitis, E is non-typeable H influenza. Alright, so we have a 30-year-old man who comes to the emergency department with fever and diarrhea. Alright, this is something non-significant. This can happen in any disease, so don't worry about it. Then there is no history of headaches, vomiting, loss of consciousness. Alright, then the past medical history is unobtainable because the patient is an immigrant. Alright, doesn't matter. But then what line drew my attention was the wife tells that the husband had a motor vehicle accident when he was a teenager and required emergent surgery. This line does tell you that he had a history of abdominal trauma or something. That is why he had an emergent surgery. When you have a motor vehicle accident, usually in blunt traumas or motor vehicle accidents, when the patient has an emergent surgery, they're usually talking about splenic rupture, right? Does it tell you why exactly this question is giving so much history? So this is what it tells you, and it will usually be the way where they try to direct you towards splenic rupture. Okay. Then now when you have a splenic rupture, so you will have 3 microorganisms. Quickly, since I have discussed this in the previous classes, quickly tell me the 3 microorganisms, encapsulated microorganisms, which can cause the symptoms in this. Very good. Yes, Neisseria meningitis, H influenza, not staph, Streptococcus pneumonia. Alright, Neisseria meningitis, not gonorrhea. Very good. So now we see that they have ruled out Neisseria meningitis for us. There are no signs of meningeal infection. So this kind of rules out meningitis. Then we come down to the other things. The blood pressure is 70/30. Chest X-ray at the time of admission shows interstitial infiltrates. Basically, they are talking about some kind of chest infection. Okay, and then you have the lab studies which tell us there is some kind of infection going on and there is a severe infection. And then what directs us towards Streptococcus pneumonia is gram-positive lancet-shaped diplococci. Right? Is that clear? Meanwhile, I check if there is anything I have to add. All right, very good. So also one more thing which I want to ask you is, yeah, H influenza, if it was an H influenza infection, what would be the description of the bacteria? All right, very good. So basically the first thing that will rule out everything for you is it is gram negative, not gram positive. And yeah, non-typeable H influenza basically means an unencapsulated. That means there is no capsule around the H influenza. And nowadays, with the invent of vaccines for the capsulated H influenza bacteria, the non-typeable or the unencapsulated ones are the ones which are causing maximum amount of infections, right? So yes, H influenza is gram negative. All right, gram negative bacilli, cocobacilli or anything. All right. And one more thing which you can know from your immunology point of view, that is The spleen, which acts as a major lymphoid organ for eradication of the encapsulated bacteria via opsonization. What happens is the IgG immunoglobulins, they act as opsins and bind to the surface of the capsule of the microorganism, all right, which is later phagocytosed by the macrophages in the spleen. So basically, I'll just put a quick drawing in so that you understand. This is your IgG, right? IgG, what it does is it binds to your it's my amount over here. I shouldn't have drawn it over. Okay, something like this. Okay, over here it binds to your bacterial cell, to the capsule of the bacteria, right? Once it binds to the this process is known as opsonization. Once it binds to it, it goes to the spleen, and where it is eaten up by the macrophages. All right. Once this binds to it, it binds to the capsule. This is how the IgGs bind to the capsule, right? And then it goes to the spleen, and where it is phagocytized. So when there is no spleen only, then how will the bacteria, like, how will it exist? Like, how will the bacteria be destroyed?
Thanks for watching. Please give a thumbs up and subscribe for more.